Poonam Pandey zinda hai. Yes, Poonam Pandey is alive. All hail and hearty. The model and actress shared a video of herself on Instagram and give this news. She talked about deaths caused by cervical cancer in India. Indeed, this was a frightful move, but Poonam successfully manages to draw nation attention to deaths caused by cervical cancer in India. Well, we also talked to Dr. Minakshi Ahuja, indeed one of the best gynecologists in India, and does a DNA on cervical cancer.
Okay, so let me tell you about it. So, cervical cancer is a cancer of the mouth of the uterus. It's not the cervical जो हम गले का सोचते हैं. It is the cervical means the mouth of the uterus. Now, cervical cancer is one of the commonest cancers in women. In fact, it lags behind only behind breast cancer. It's number two cancer in women, and one woman dies every 8 minutes because of cervical cancer. So India has about 25 to 27% of the world's cervical cancer burden, but the deaths in India are much more. Unfortunately, we are not aware about the disease. However, since it's caused by the virus called the human papilloma virus or the HPV virus, this is actually preventable by getting a vaccination. So there's a vaccination which is available. There are 3 doses of the vaccine which have to be given, or 2 doses if you are less than 15 years old. And these vaccinations are given, and it actually almost rules out the chances of having cervical, other anogenital, as well as oropharyngeal, that is, even cancers of the few cancers of the mouth and the throat, can be prevented by taking this vaccine.
So, ma'am, actually, you also mentioned this thing that girl age less than 15 years should take this vaccination, and finance minister also mentioned that they're promoting the doses for girls aged between 9 to 14 years. So, why this particular age is crucial for women?
Okay, so the point of the vaccine is actually that WHO, as well as our FOGC, that's the Federation of Obs and Gynae, and AIP, all recommend that the vaccine can be given anytime between 9 to 45 years. So if you've crossed that window, it does not mean that you can't get the vaccine. In fact, we also have a catch-up vaccine for women who are married or who've had children also. So the vaccine can be given anytime till 45 years of age. However, the government can't afford to give it free to all women, right? And chances that it works the best is when you are sexually naive. That's number one. So when you're very young, that is, you've not had sex. And number two, your immune response is the best. So it has been studied all over the world that if the vaccine is given if you're less than 15 years old, the efficacy is the best, the doses are most effective, and we need one dose less. So the vaccine works best between 9 and 14. And since the government can't afford to give it to all women, so in many countries, like even in Australia and all, they gave the vaccine actually free of cost to girls between 9 and 14. In fact, they gave it to the boys also. And they have almost eradicated cervical cancer in Australia. Australia has been declared HPV free.
So, ma'am, you just mentioned about this thing that this vaccine is not free in India, obviously. So, what's the cost of this vaccine if I want to get myself a dose? So, what's the cost of this vaccine?
So you have to get at this age, so anything over 15, you will need 3 doses, 0, 2, and 6 years of age. There are multiple different type of vaccines available. There's a vaccine which is available, which is a quadrivalent vaccine, which each dose is roughly around 4,000. There's a nonavalent vaccine which has 9 serotypes of the virus available, which is supposed to be the most highly effective. Each dose of that is about 11,000. However, the indigenous vaccine, which is now available from India, that is the Indian developed vaccine, we can get the dose for about 1,500 to 2,000 rupees each. But the government has already made an initiative that they will be giving it free to girls less than 14.
And I guess I'm pretty sure, not just guess, I'm pretty sure that it's really, crucial for women and everybody should get themselves a dose. Uh, but
Absolutely.
yeah. But what are the symptoms of it? Because I was just learning about its symptoms, and the symptoms of cervical cancer is kind of equivalent to the fungal infections also. So what are the exact symptoms of this cancer?
So the first thing that you need to understand that the earlier any cancer is picked up, the better it is, and that's only the time that it helps that we can treat it or prevent it. So there are normal screening procedures like known as a Pap smear, which is a test of the secretions from your cervix, which is done for women. So you must go for your annual health checkup and get a pap smear done regularly. That's number one. However, the symptoms are basically dirty discharge, blood stains discharge, bleeding in between cycles. So if there's anything that you feel that it's out of the ordinary, that you have bleeding either in the middle of your, when you're in the middle of your cycle when you're not having your periods, or there's spotting on exercising, or bleeding after sex, please see your gynecologist immediately. But the key here is in prevention. So regular health checkups, because the screening test is very simple. It's just a simple examination and a smear that all women should come and get it done regularly from their gynecologist.
Definitely, that's a very important point. And also, I was learning. I was just, taking out the views of some people. Also, I was going through many of the articles, and they are saying that a lifestyle of a women is basically behind the cervical cancer. Like if you have multiple sexual partners, that also lead to this cancer. So I want your point of view that having multiple sexual partner or having a certain type of lifestyle will cause this cancer.
So this is actually almost like a myth, because even when we were in medical school, we used to read that it is a disease of women who are sexually promiscuous, who've had many partners, or it's seen in prostitutes and all. So ऐसा नहीं है. You have to be very clear that even in a single partner relationship, you can get HPV infection, right? And so it is very important to think that just because you're in a single partner relationship, and in fact, even with condoms, HPV can be transmitted. So it becomes imperative for every woman to get the vaccination done, as well as even then. So currently, the recommendation is that even if you have the vaccine, you should be getting regular screening done, and you must come for your annual checkup as well as your pap smear regularly.
So, if once you're diagnosed with cervical cancer, then what are the precautions we should take?
So the point is that cervical cancer is actually a very slow growing cancer. So if your pap smear shows anything which is even precancerous, so it's usually picked up on regular screening when it is precancerous. So the first story is about prevention, which is with the vaccine. Then there's this screening to pick it up early, which is by pap smear. If you have problems and we do the smear and we find that there's inflammation, where there's something known as CIN1, 2, or 3, which means it's precancerous, we can treat it at that time itself completely. However, like any cancer, it means that the cells have already become highly abnormal. The disease has started spreading, and then only say surgery, radiotherapy, chemotherapy are the options. And there is when there's a risk of morbidity and mortality associated. So very clearly, what we are looking at is preventing the disease and early pickup of the disease. Where it is still not even happened, it is pre-cancerous and we can treat it comfortably.
And when we are
Cervical
talking
cancer,
about,
like any cancer, like I said, that it is life-threatening and it needs excessive surgery, chemotherapy, radiotherapy, like any other cancer. But since it's a very common cancer and it is one of the probably one of the very few cancers which can actually be prevented. Otherwise, आप कहाँ सुनते हो कि आप prevent कर सकते हो lung cancer या breast cancer? You can't prevent these cancers. However, HPV linked cancers are the only cancers which can be prevented. There is a vaccine only against HPV cancers, and we have been giving the vaccine for the last more than 10-12 years. So it's high time, if you're not vaccinated, you must come and get your vaccinations done. And if you've already been sexually active, get your normal screening also done. So it's not only about getting the vaccination, it is also about getting regular screening tests.
And also, when you were talking about the sexually transmitted diseases, there are some people who also state this fact that smoking, drinking habits, this can also intensify the effects of cervical cancer. So, is that true?
So, see, the cancer is caused by a virus. Once
Hmm.
it reaches your body and once it's converting to cancer, definitely sexual promiscuity, alcohol, smoking, that will work on your immune system also.
Hmm.
So
So,
you
it
will
will decrease the
always,
immunity. Yeah.
yeah, so the disease will always spread faster and your body's capability of fighting against that disease decreases. But very clearly, getting the vaccination and regular screening is the only way to go. Healthy lifestyle helps you with everything, not just prevention of cervical cancer.
So, any woman who is pregnant, who is expecting, can also be diagnosed with cervical cancer.
So normally, because cervical cancer is a cancer of young women,
Hmm.
definitely what we are doing routinely is the screening and all while we are doing when a woman is pregnant. And the vaccination is offered to a woman after delivery also. But yes, cancer can happen at any time. So it can happen in pregnancy or non pregnant. And it depends if the symptoms are there, then it needs to be treated. Not a common thing to have women in pregnancy having cervical cancer. But I think more importantly, once they deliver, we don't give them the vaccination while they're pregnant, but we discuss about it. And after their delivery, we give them the vaccination also and start their regular screening also if it has not been started earlier.
So, will it affect the health of the baby also?
No, see the HPV transmission can occur in utero or during delivery,
Hmm.
but it's not about the baby. It's more about the cancer affecting the mother's lifespan only if it's already there.
Definitely. So that was a very important point. And when we were talking about Poonam Pandey, she's the well-known actress. Uh, I was just going through some of her videos. She has posted a video 5 days ago. She has posted a video, and she didn't look very ill. Like she was walking properly. She didn't look so ill, and there was no signs that she could be diagnosed with cancer. So when you're suffering for cervical cancer, so does it show in your body? Does your face look dull, or it will affect your looks? Like what happened exactly in this cancer?
I can't say what happened in her case. It could be an old video also which was being shared or posted. You can't say. With me as celebrities, you can never be sure. She must be undergoing treatment. I'm sure that much awareness is there that if there's a problem, she must have been seeing a doctor or something. She must be taking treatment for it. But I guess probably it was still already, extensive, and that's why see, Poonam Pandey. You remember there was that Big Boss with Jade Goody had come. She was a Big Boss
Hmm.
contestant. She died at
Yes.
27 also because of cervical cancer. So it is a cancer which is very common and commoner in young women also, and that's why you need to start taking precautions much earlier than any other cancer.
The question was mine, like if it will affect your daily life, you'll not able to walk, you'll not able to eat anything, but like once you're diagnosed with the cancer, so
So
will it
also
affect
cancer
your
and
regular
also
life?
the treatment of the cancer. So I don't
Yeah.
think it's that, I don't think people need to have that fear that, you're walking around on the street and you're perfectly normal and healthy and being perfectly normal and suddenly you'll pop off because of cervical cancer in 5 days. No, it doesn't happen like that. Like I said, probably it might have been an old video or maybe I've not seen that, but I'm sure it's either an old video or she must be getting treatment done and getting a social media thing done in 5 minutes. What you are in the rest 23 hours, and 55 minutes is up to you. What you post for 5 minutes is a different thing all entirely.
So what are the chances of surviving from this cancer? Is there any chances, or are there any stages, like first stage, second
Of
stage,
course,
like the other
any
cancers?
every cancer has its own stages, and depending at what stage it is diagnosed, there is
Hmm.
treatment available, and the survival depends on that. Like I'm saying, that it's not possible that in 5 days she had cervical cancer, she was perfectly hale and hearty, and then just suddenly something happened. So I think that story will still take time to come out if someone cares to share. But that I don't think there should be a mass hysteria that you're walking about and you're going to pop off in 5 days with cervical cancer. But what it means is get your vaccinations, get your screenings done, see your gynecologist regularly, and if ever there's any abnormal bleeding, please see your doctor immediately. I think that's a take home message that we should be getting today. And I'm really proud that our finance minister has taken this bold step of providing the vaccine free. It's high time that it was done in our country, especially now that we have an indigenous vaccine which is made in India.
Yeah, the decision was very welcoming, but I guess this topic should be discussed, should be widely discussed, because as you say that it's the second most common cancer in India, and especially in women. So women in our houses obviously expected not to take care of their of their health. They are not just into this, that they are not visiting doctors very regularly. So it's very important that our government take these kinds of initiative, so that people get to know more about this. So yes, that's Dr. Meenakshi Ahuja, talking about the cervical cancers, the symptoms, the treatment, and she has explained it so well. You have explained it so nicely, and for any layman, this video is really important. So first of all, the 5 pointers which Dr. Meenakshi Ahuja has given to us, that first of all, diagnose yourself. If you are facing any bleeding, and if you are having a bleeding while the intercourse, while your periods, you have excessive period blood, then you should definitely consult your gynecologist. The most important thing is consult your gynecologist. Don't be a self doctor. And also take your doses. Like I think, ma'am, there is no age to take this dose. The girl
Till
between 9 to
45, the
45 can take
vaccine can be taken. It's a catch-up vaccine later. And earlier it's called the, primary vaccination, but it is a vaccine that can be taken till 45 years of age.
Yeah. So those women who are thinking that they have just passed off the age, so no, it's not the case. You can take the vaccine. You can get yourself checked at any stage, and the most important thing, this is the only cancer, I think, one of the cancers which is curable. So if it's curable at the early age, at
Preventable.
early
It's
stage, yeah,
preventable.
it is preventable. So is it possible that the cancer can return after some time, like if we get if we get ourselves cured
No,
for the time
if
being?
you have the vaccine in your body, the antibodies are there. The virus cannot enter your body, so you can't get the cancer.
Okay, so it is like polio.
Absolutely, it's
Yeah.
caused by a virus. So exactly the same thing. It's caused by a virus, and there's a vaccine available. You have the antibodies in your body, so you can't get the disease.
Yes. Again, I would like to thank Dr. Meenakshi
Thank
Ahuja for
you.
taking out time for talking to us. And on such a short notice, she has explained the cervical cancer beautifully. She has also talked about the symptoms, or about the causes, about the treatment. And if you want to know about more about the cervical cancer, if any of your friends and family members are suffering from it, you can definitely leave your comments. You can leave your questions in the comment section, and we'll get back to you. Thank you, ma'am. Thank you so much for joining.
Thank you for having me here.